So today we're going to finish up chapter 10. We are going to look at 10.2. 10.2 is improving human health, and we will also look at 10.3, which is called public health and you. So we'll start with improving human health. All right, so health programs, like public health programs, they came to Canada after World War I, and it was a direct result of that Spanish flu from 1918, that Spanish flu pandemic that we talked about last class. And Canadians realized that they needed to rebuild the population, and they didn't want to go through such a pandemic ever again. So in 1919, the Canadian government established its first Department of Health. And today, the provincial health departments throughout the country do jobs such as monitoring the safety of drinking water, checking the pollutants in the air that we breathe, and taking measures to avoid outbreaks of disease. In Alberta, the public health service is called the Regional Health Authority, and it offers many public health programs and services. So for example, water quality. The specialists, they test water, they'll report any problems to the public. For example, if the bacterial count in a lake reaches dangerous levels, the beaches may be closed until the count returns to safe levels. And water is tested on a regular basis to make sure it's safe for drinking, for cooking, for bathing and swimming. And then water is treated to make it safe to drink. And treatment plants will add chemicals like chlorine to kill harmful bacteria. Removal of garbage. Most of our garbage ends up in a landfill site, and it's a prevention method. It prevents waste materials from harming the environment or entering our water system. And before a landfill is used, the ground is properly sealed to make sure that toxic chemicals don't accidentally leak into our water supply. Interesting point here, the Romans were actually one of the earliest cultures to recognize the need for sanitation and safe water, and they built public baths and toilets, and they constructed waterways called aqueducts, shown here, to transport fresh water into towns. And wealthy people, they even had water piped into their homes. So the short video here you can take a look at showing a Roman aqueduct. It's a National Geographic video. Treatment of human and animal waste is very important. So in sewage treatment plants, solid wastes from like humans are removed by settling or filtering, and helpful bacteria will decompose any of that organic matter, and then the water gets treated chemically to make it safe to drink. For farming and livestock operations, because they produce large quantities of manure, that has to be treated as well. So some producers, they'll store the manure in large lagoons on their farms, and then modern treatment facilities will separate the solids from the liquids, they'll remove any excess fertilizers, and then they'll recycle the clean water for farm use. The liquid manure can then be spread on the cropland. All right, next is air quality, which is very important, making sure that we are breathing in air that is safe for us. So air quality is tested and the results are provided to the public, like for example shown here in this diagram. So Health Canada has developed standards and guidelines that list allowable levels of pollutants in the air you breathe. When the levels of pollutants get too high, people are advised to stay indoors, avoid heavy physical exercise, and the reason being is because physical exercise increases the body's need for oxygen, and it may be difficult to get that when it's such poor air quality. All right, so here we have some colors showing the air quality index category. So for example, 0 to 15 would be very good. 100 plus would be very, very poor air quality. Just a reminder about smog. Smog is a mixture of air pollutants, and it's one reason for poor quality air. So a smog alert warns people who are at risk or suffer from heart or lung problems to take protective action, such as staying indoors. Vaccinations. Vaccinations are important. They increase people's ability to fight off a disease. In Canada, children get vaccinated against diphtheria, whooping cough, measles, mumps, tetanus, polio, and rubella. People who travel to other countries may get shots against things like yellow fever, typhoid fever, or hepatitis. And it's important that they check health information for the destinations that they're traveling to in order to adequately protect themselves. So public health officials, they often develop new vaccinations that respond to new outbreaks of disease. For example, meningitis, it's an inflammation of the covering of the brain. So when or if this disease starts to spread in an area, public health officials will start providing free vaccinations against it to children and teens and those that are most likely to get the infection. This diagram is showing a child here. So when children are about 2 months old, they start receiving these vaccinations, which are injections that provide them with protection from various contagious diseases. And they get these injections regularly until they're about 4 to 6 years old. And then as they get older, you might get booster shots to renew that protection. For example, a booster shot against tetanus, which is also called lockjaw. Food safety is important. Health authorities, they'll use newspapers, radio, pamphlets, brochures, the internet to promote food safety awareness and making sure that workers in restaurants and food companies and meat packing plants are handling food safely. So education campaigns like this one here, Fight Back, reduces the number of illnesses spread by poor food handling. So it promotes 4 points. For example, here it's clean, wash hands and surfaces often, cook foods to the proper temperature, especially the meats, separate, do not cross-contaminate, right? Like keep your cutting board separate for the meats and your vegetables, and chill, making sure that foods are refrigerated promptly. And the choice is yours, right? So these are just some of the programs developed to decrease the spread of disease and protect human health. And that's why educating people about health is very important, and that's why it's learned in schools. The next link in the chain is you. Are you concerned about your health? To learn the many ways you can stay healthy, do you care enough to maintain high standards of personal hygiene? When you get sick, are you willing to make sure that you're not going to spread that disease to others? Do you take time to learn how to protect your own and others' health and safety by taking training, for example, in first aid, life-saving, swimming, babysitter's training? All right, so now that you understand better how to prevent the disease, the next step is you. All right, so these are the questions for 10.2. All right, so 10.3 is public health and you. So vaccinations, like we talked about, have reduced the number of people who die from communicable diseases. For example, smallpox was a disease that killed millions of people around the world. Today, the smallpox virus only exists in laboratories, and vaccinations against it is no longer recommended. But does that mean that communicable diseases are no longer a serious problem? And should you just ignore public health guidelines? The answer is no, because there are still many reasons for keeping an eye on public health guidelines. All right, diseases are not going away. Many old diseases that were thought to have disappeared are resurfacing, and these include polio and drug-resistant variations now of tuberculosis. And there's new diseases emerging as well, like AIDS and SARS. So public health guidelines are there to help protect you from these and other diseases. So this chart here, just looking at factors and public health guidelines. So the factor, for example, there's population growth, and if there's overcrowding, the concern here is that overcrowded conditions increase the chances of being exposed to pathogens. So it's important to use these public health guidelines. Good personal hygiene, treating and disposing of wastes. Migration is a factor. Diseases can be carried from country to country or from a rural community to cities. So it's important to monitor diseases and keep an eye on the level of disease. When levels get high, emergency response plans may prevent the migration. Travelers and their belongings may also start, may be disinfected to prevent the spread of pathogens. Lifestyle. Example, people eating out. So it's important that the public health, they do restaurant inspections and they ensure food handling practices are safe and the eating areas and the utensils are kept sanitary. Travel. There's an increased exposure to disease from travel. For example, in different countries, it might be improperly prepared foods. Maybe the public washrooms are unsanitary. All right, so public health guidelines tell travelers to make sure that they're getting special vaccinations before they travel to some countries. And there's also other information like brochures that will explain how to protect themselves from pathogens in the food and water. All right, next is food supply. So our food comes from many different countries, and that food may harbor pathogens. So it's important for our public health that there's food inspectors that test the foods for pathogens. Sexual activity and childbirth. So the concern is that sexual contact may result in sexually transmitted diseases, STDs, and the spread of STDs. Babies may be born underweight. The mothers may be unhealthy as well. So the public health provides STD awareness programs to give the facts. Prenatal nutrition programs teach mothers proper nutrition. And there's awareness education programs, for example, for fetal alcohol spectrum disorder, to ensure that there's a reduction in the number of mothers who drink during pregnancy. Drinking and smoking, I would say here, during pregnancy. Health warnings. Health authorities will release warnings or advisories to alert people when there's a major health concern. This is an example. It's a poster from China that tells people how to reduce the spread of scarlet fever. So on this poster it says, go to the hospital as early as possible when infected, see a doctor as soon as you have a sore throat, and take the vaccination. Okay, one example of a health warning, for example, is a food recall. In a food recall, all products containing a contaminated ingredient has to be removed from store shelves. And you'll hear this on the radio, on television news programs. They'll name the product, they'll explain the danger, and tell the public what to do. Boil water advisories. So if tests show that drinking water is unsafe, maybe it's contaminated or the levels of pathogens are too high, then health authorities will start telling the public to boil the water for drinking, cooking, and brushing the teeth. Mass vaccinations. When a communicable disease is beginning to spread, health officials will start providing free vaccinations for people likely to get the disease. And road safety. So protecting people who are riding bicycles or they drive vehicles. Public health authorities provide information about proper use of helmets, seat belts, and other safety equipment. There's also laws in Alberta that enforce the use of child safety seats and bike helmets. So all cyclists under the age of 18 are required to wear helmets when they're biking because falling off a bike and hitting your head can cause brain damage. And then public health guidelines also explain to parents how to properly install and adjust child car seats to protect the infants and babies from injury. From the womb to the grave, public health guidelines help prevent disease and promote wellness for each stage of an individual's development, right? From the womb to when you're like seniors. So there's the Canada Prenatal Nutrition Program. It educates pregnant women about lifestyle issues like foods to eat, vitamins to take, and to make sure that the baby develops properly, and not using alcohol, tobacco, or drugs while pregnant. So coaching women who have these risk factors that may threaten their baby, it has positive results. There's also positive results just looking at the costs. Babies who are born healthy will save the public health system $600,000 each in hospital and medical care costs over the course of their life. So if babies are born healthy. Children get vaccinated then against common diseases before they start school. It reduces the spread of communicable diseases and flu shots as well to protect during the flu season. Here we have public health nurses. They work with teachers to promote health. An example is tobacco. So using ads like this one, which is developed by Health Canada, takes the glamour out of smoking. And learning the health risks helps you make better choices. And here, health guidelines promote staying active and fit to live long and well. So here, they're doing some sort of exercise, I believe Tai Chi. And so on average, someone born in Canada today can expect to live about 67 years free of ailments that limit their physical activity. So you can extend your life and have a healthier life by following these guidelines and having an active lifestyle. And how important are your personal actions? So it is very important. So for example, just washing your hands protects others from disease because it helps prevent the spread of infectious diseases. It takes about 30 seconds to sing happy birthday twice. That's how long you should be washing your hands. So that's just one aspect, right? Hand washing. Other important choices: protect your own health, take care of your personal hygiene, get your vaccinations, keep informed about health advisories, make wise lifestyle choices, make sure you're eating a well-balanced diet, moving, getting exercise, and avoiding things like smoking alcohol and non-prescription drugs, avoiding sexual contact, adopting safer practices like washing your hands, wearing your bike helmet and seat belts, and practicing safe sex when you do become sexually active. All right, so your choices affect you as well as the people around you. All right, so we'll stop here. This is the 10.3 questions as well as the chapter 10 review questions.